I would love for you to describe what it means in terms of metabolic disorder or metabolic science. Can you
Yeah.
explain a little bit about what that entails, and what that, not just like how to treat it, right? Which we know there are nice treatments for it, but like, what is it and why do these treatments work? How do they
Yeah.
work?
Janine, you were
Yeah.
saying this at the beginning that it's not just type 2 diabetes. There's like a
Yeah.
root to insulin resistance and metabolic syndrome that predates it. And I don't think that most people know that.
Yeah.
So people think that fat is the main thing that we're treating. And actually, it is so much bigger than that. Fat is an annoyance, but it's both the secondary endpoint to metabolic dysfunction, and then it creates more about metabolic dysfunction. So in treating it, Lisa was talking about how her adhesions were decreased, how some of
Mhm.
her emotional trauma from childhood was
Mhm.
decreased. There's a reason for that, and there is science there, right? We know that people who carry excess weight have increased rates of abdominal adhesions significantly. We know that unfortunately children that carry childhood trauma have about 50% increased rate of obesity down the road, and then that leads to depression and anxiety and inability to heal. So the fat itself has a lot. It's really active is how I like to describe it. It's really the most powerful organ in my opinion. And metabolic syndrome, or metabolic dysfunction as I call it more globally, is really what happens to lead to the fat. And whether that is binge eating disorder, where we have decreased leptin, which is a satiety hormone, and like a lack of reserve in the brain and stomach for stopping, whether
Yeah.
we see that, or we have insulin resistance, which is like insulin is my jam. It's my favorite hormone to talk about. We have all sorts of imbalances that will then lead to weight. And then when you put on the weight, we have negative feedback signals and that further dysregulate what's going on. So a lot of times people will come to me and say, I am trying so hard and the
Yeah.
weight won't stop coming on. And I know
Mhm.
you won't believe me, they'll say. And I'm like, of course I believe you. This is all I do. Of course. Like you don't need to
Yeah.
Yeah.
preface that. But what happens is that as insulin resistance grows, as metabolic syndrome dysfunction grows, it's really impossible for the body to become efficient at burning whatever you're bringing in. And it just goes into a fat storage mode. So metabolic dysfunction globally, I include as insulin resistance, even early insulin resistance. And then the true definition of metabolic syndrome has to do with elevated blood sugar, low HDL, which is the good cholesterol, high triglycerides, which no traditional doctors are looking at, and I'm not sure
Yeah.
why, because high triglycerides are a sign of your body just not understanding how to take in carbohydrates. Truly,
Yeah.
they just don't know what to do with it at all. And if you see that, it's a roadmap to tell you what to do next. And then we also see increased abdominal circumference, which weight, right? It's a more scientific marker actually than weight, because weight is not
Wow.
always the biggest indicator. So if we can help people identify some of that dysfunction early on, in those early stages of weight coming on and not understanding, and then even a doctor says, oh, your BMI is not high enough for these meds, or just like work a little harder. If you can educate yourself on what you're looking for, I think we can stop a lot of disease in its tracks. And actually, just a small plug, because we're so unique, I actually created an at-home testing kit that tests for all the things that make up metabolic syndrome,
Hey,
including,
that's great.
yeah,
Wow.
including
We'll
Yes.
put it in
fasting.
the, we'll put it in the notes.
Oh
Yeah.
Yeah.
yeah, that's
Oh my
amazing.
goodness.
And I have a discount code for you guys. My assistant did it while we were sitting here. I was like, oh, let's get
Woo!
Yay.
Oh
so
heck yeah.
yeah, but my testing kit, what it does is I long recognized that there was a problem, that people would come to me and say, I ran all the labs and everything looks fine. And then I'd look at the same set of labs and I would be like, but no, you have early insulin resistance, you have metabolic syndrome. And to somebody's point, I don't know who said it at the beginning, but like we are a system that only looks for the disease state. So
Mhm.
it's ridiculous for a patient to come in with a hemoglobin A1C of 5.6, which is how I train. And they're like, maybe eat a little better, but we weren't even using the words pre-diabetes. And at that
Yeah.
stage, it's just a runaway train. Like for most
Yeah.
people, it will progress to type 2 diabetes. So we want to catch, and insulin, and then I'll stop talking. I know I could just go on and on about this day, but
Oh,
insulin,
please,
No,
please, this is an
please.
education place. We
Don't stop
love it
talking.
here.
this is
You're good.
This is the
awesome.
place where we want you to
Yeah,
talk. Yes.
but insulin, and we use the term insulin resistance, but what is that? It means that the body is producing insulin. Your body, your pancreas is producing insulin, but your body's not receiving it, and it's giving a signal to go back and make more insulin. And insulin is a hunger and a fat storage hormone. And so it's actually a very useful, scientifically validated tool that's not used in clinical medicine, where we can test your fasting insulin. And if your fasting insulin is high, and even if your hemoglobin A1C hasn't caught up yet, we can predict pre-diabetes or insulin resistance 15 years before we start seeing an increase in the average blood sugar marker.
Oh my goodness.
And you guys were talking about PCOS, and this is what we see in PCOS. I love PCOS patients because for me, they're actually very simple to manage, which is so sad because they feel like they're the most complicated patients.
Yes.
Yeah.
Right?
That was like simple. Wow.
Yeah, I know. And that's not to minimize what anyone has gone through, but it's pretty straightforward. And I think it's very sad that we don't have more tools in traditional medicine. Now, all my doctor comrades are doing like the best they can. They get 15 minutes, their boss tells them that's all they get. And we didn't necessarily learn about these things. But, PCOS is a disease primarily of just insulin resistance. And that insulin resistance gets worse. And then the disease of PCOS gets worse. And fat comes on, and fat makes PCOS worse. And it's just horrible. You said chicken and egg. It's like it's a little bit of both, but they're very related. And if you can target the insulin resistance through diet, lifestyle, knowing what to do without killing yourself on the treadmill or eating like rabbits, like knowing how to eat, and then using the right medication, we can really get to the root of it and then change the trajectory of all the other things that come along with it. So
yeah. Oh, that's fascinating. I love all that. No cuts allowed.
Yes. No.
But everything you're saying, it's to validate all of it, all of your shared experiences and what you're living. It's just, I just think that there's been a lot of gaslighting in this field, and a lot of doctors aren't in the know, and it is tough.
Yeah. I think when you talk to someone about, like when you talk to a doctor, and anytime they have to say you just need to diet and exercise, you cannot come to somebody that has a very complicated issue and say just anything. Like it's not just as easy as that,
Right.
Yeah.